right, welcome back. Talking to the doctor about our sleep patterns here.
That's right.
Because if you haven't heard, we started our morning show at 4:30 today, and that's our new schedule. That's the sound I made this
kills me.
morning.
Just thinking about that.
Sleep is important, though, isn't it?
It's very important.
Skin and everything.
For skin and health and eyes and everything.
Well, we're going to try to do better at that, I think. But you've been getting a lot of emails since being on our show. And people asking questions, and they're all kind of along the same themes in a way. Yeah, you get several about tummy fat or belly fat. Here's one. Let me read one. This person says, I'm experiencing excess fat and loose skin around my stomach that diet and exercise is not helping. I've heard that liposuction or a tummy tuck may help. What would you recommend?
Well, both of those are very good procedures to help with that, because even if you get down to your ideal weight, a lot of people still have a little bit of excess fat they just can't get rid of.
Right.
And if you have loose skin, all the dieting in the world will not make that better. Loose skin just doesn't go away. And so a tummy tuck really is the way to get rid of the loose skin and those little residual areas of fat. A little bit of liposuction. Perfect for that.
Really, and you hear this a lot as well from women who've had children, and several, I see you're about that. I've had 3 kids, and that's kind of when the belly, you know, lost its shape.
And then people just want to get back to where they started. And I think this is the little bit of lipo or a little tummy tuck is a great way. And sometimes we do a combination. We do a mini tuck because they just have a little bit of loose skin, and we do a little liposuction at the same time. That combination many times is just enough to get them back to where they started and into a 2-piece bathing suit sometimes.
There you go. Okay, now this person has lost a lot of weight, and it's not just her belly, it's kind of excess skin everywhere. She's lost over 75 pounds.
Wow.
She's tried, tried many different exercises to get rid of the loose skin, but she says, I've got it on my legs, my stomach, my arms with no success. So is that sort of the same problem?
Same thing, and with the arms, many times we do have to go in and take a little bit of skin there. And sometimes with the thighs and the inner thighs, sometimes you get a little bit of loose skin there, and we do a little lift. We call that a thigh lift.
Okay, so answers for everybody. Okay, let's go to the eyes.
Okay.
Because we hear about the droopy, you know, eyelids a lot. Okay, this lady says, when I study my eyes in the mirror, they just don't seem to match the rest of my face. They no longer look bright and fresh. In fact, people always ask me if I'm tired, even if I'm not. Any suggestions?
Well, the eyes are really the focus of the face. When you first look at someone, you look right at their eyes. And a lot of times the upper eyelids are the first thing to show. And usually it's not just an eyelid issue, it's a combination of the brow. If you look at your eyes, you've got the eyebrow plus the eyelid, and many times it's a combination of both, where the eyebrow is dropped, and that kind of pushing makes that lid look even worse.
Okay, and a lot of ladies say, I can't even put eyeshadow on anymore because it's hanging over that part of my eye.
So many times what we'll do is a brow lift, which lifts the brow up, gives you a little more view of that upper eyelid, and then we take a little bit of skin, and that combination works really well.
Yeah, and you've got a lot of ladies who've never had any kind of cosmetic surgery before, but when they see this with their face, that's when they really want to make themselves look
what's
better.
great about eyelids is that a lot of times the eyelid surgery lasts a lot longer than all the other things that we do.
Okay.
It's really nice surgery to do.
You want to tackle breast implants?
Oh my God.
There's all kinds of questions about those.
Okay.
All right. For instance, this person says, I'd never considered it until recently when I was shopping and getting fitted for my wedding dress, and I realized that I maybe want this done before my wedding. So she wanted to talk about the different options with breast augmentation. The
options are numerous, as many as you can think about.
Yeah.
We have a size option, so you can go bigger or smaller. There's a type of implant, because you can go a wider implant or one that's a little perkier. You can do silicone or saline. Those are two. One gives you sort of a perkier look. The silicone is more of a natural look. And so these are the many options that are available. You can go under the muscle, over the muscle, all of which we talk to people about and give them those options when they come in for a consultation. And then we sort of educate them about what all the things are available to them.
Yeah, and we've talked about all those different options too. This person says, how do you know when it's better to have an uplift or implants or both?
Yes, and that's another thing hard to know without seeing the patient.
Yeah.
But usually when you've got a lot of drooping of the breasts, you're going to need an uplift, and many times if you've lost a lot of the fullness up here, you're going to need to have implant also.
Is there something where you can kind of image this for them, or I think there's even like, are there some shirts you can put on?
What we do is we put patients in a bra and we put an implant in there, and we size them right there in the office and gives them a really good idea of what's going to work for them.
Okay, sounds good. All great things. Let's see, you got time for one more?
I think so.
Okay, let's do this one. I just celebrated my big 4-0, and my skin appears blotchy and weathered, and also there are new lines and wrinkles appearing every day, it seems. What sort of treatment would you suggest?
Well, I know we're going to be talking about skincare coming up, and all the health things. There's a lot of things you can do. Many times we'll do a chemical peel or laser skin resurfacing, and those combinations actually work very well in conjunction with skincare. And that's something that I know you'll be talking about soon, but the skincare is an essential part of actually, if we go in and kind of clean the slate, wipe the slate clean with laser or chemical peel, then we put them on a skincare regimen that actually maintains that.
Good. And a lot of people may not realize that you do that as well as the surgeries.
That's right.
Well, there you go. Some of your questions answered by Dr. Reese Brandman. Let's put up the information, of course, about Cosmetic Surgery Center. If you have any more questions about what you've heard, or you want to send them some more questions that we may answer on the air, just give them a call at 227-0707 right there at Executive Center right off of Shackelford in West Little Rock. Thanks so much. This was fun.
It was fun.
It. All right. Keep those questions coming in, and he'll be back in about, what, 4 weeks?
About 4 weeks.
Okay.
There you go.
We'll be back in a moment, in 2 minutes, with more on your forecast for the rest of the week. Stay tuned.